1. A 45-year-old man presents with crushing central chest pain radiating to his left arm. His ECG shows ST elevation in leads 2-3 and AVF. What is the most likely diagnosis? A. Anterior STEMI. B. Inferior STEMI. C. Lateral STEMI. D. 2. A 60-year-old woman presents with acute dyspnea and pink frothy sputum. On examination, she has bilateral crackles and an S3 gallop. What is the most likely diagnosis? A. Asthma exacerbation. B. Pulmonary embolism. C. Acute cardiogenic pulmonary edema. D. Pneumonia. 3. A 30-year-old patient presents after ingesting 30 paracetamol, acetaminophen tablets 6 hours ago. Which test is most important for immediate management? A. Arterial blood gas. B. Serum paracetamol level. C. Liver ultrasound. D. Coagulation studies. 4. A 25-year-old man presents with sudden severe headache described as the worst of his life. His neurological exam is normal. What is the next best investigation? A. CT brain without contrast. B. C. Lumbar puncture. D. Angiography. 5. A 22-year-old woman with asthma presents in severe respiratory distress with a silent chest, SpO2 85% on room air, and altered mental status. What is the next best step? A. Administer salbutamol nebulizer only. B. Immediate intubation and mechanical ventilation. C. Start IV corticosteroids and monitor. D. High-flow nasal cannula oxygen. 6. A 40-year-old patient presents with generalized tonic-clonic seizures lasting 10 minutes without recovery in between. What is the diagnosis? A. Febrile seizure. B. Simple partial seizure. C. Status epilepticus. D. Psychogenic seizure. 7. A 7-year-old child presents with fever, drooling, stridor, and sitting in a tripod position. What is the most likely diagnosis? A. Croup. B. S. C. Foreign body aspiration. D. Bacterial tracheitis. 8. A 55-year-old man presents with sudden onset severe chest pain radiating to the back. Blood pressure is 180-100 mmHg and unequal in both arms. What is the most likely diagnosis? A. Acute coronary syndrome. B. Aortic dissection. C. Pulmonary embolism. D. Pericarditis. 9. A 19-year-old man presents with right lower quadrant abdominal pain, fever, and guarding. What is the most likely diagnosis? A. Acute appendicitis. B. Renal colic. C. Gastroenteritis. D. Testicular torsion. 10. A 28-year-old woman at 34 weeks gestation presents with painless vaginal bleeding. What is the most likely diagnosis? A. Placenta previa. B. Placental abruption. C. Threatened miscarriage. D. Ectopic pregnancy. 11. A 45-year-old chronic alcoholic presents with confusion, ataxia, and ophthalmoplegia. What vitamin deficiency is most likely? A. Vitamin B12. B. Thiamine. C. B3. D. Folate. 12. A 25-year-old man presents with a gunshot wound to the chest. He is hypotensive, tachycardic, and has absent breath sounds on the right. What is the immediate management? A. Endotracheal intubation. B. Chest ray. C. Needle decompression followed by chest tube insertion. D. Intravenous fluids. 13. A 70-year-old man presents with fever, confusion, hypotension, and a lactate of 6 millimol. What is the most likely diagnosis? A. Hypovolemic shock. B. Septic shock. C. Cardiogenic shock. D. Neurogenic shock. 14. A 50-year-old woman presents with sudden onset unilateral weakness and aphasia. CT brain shows no hemorrhage. What is the next step? A. Start aspirin only. B. IV thrombolysis if within 4.5 hours of onset. C. Immediate neurosurgery. D. Wait for MRI. 15. A 35-year-old man presents after a motorcycle accident with severe pelvic pain and hemodynamic instability. What is the best initial management? A. Pelvis. B. Fast ultrasound. C. Apply pelvic binder. D. Exploratory laparotomy. 16. A 22-year-old man presents with scrotal pain, swelling, and absent cremasteric reflex. What is the most likely diagnosis? A. Epididymitis. B. Testicular torsion. C. Hydrocele. D. Inguinal hernia. 17. A 65-year-old smoker presents with hemoptysis and weight loss. Chest X-ray shows a central lung mass. What is the most likely diagnosis? A. Carcinoma. B. Squamous cell carcinoma. C. Small cell carcinoma. D. Glioma. 18. A 30-year-old man presents with high fever, hypotension, diffuse rash, and desquamation after tampon use. What is the most likely diagnosis? A. Kawasaki disease. B. Toxic shock syndrome. C. Scarlet fever. D. Sepsis from pneumonia. 19. A 40-year-old man presents with hematemesis and a history of alcohol abuse. He is hypotensive and tachycardic. What is the most likely cause? A. Peptic ulcer disease. B. Esophageal varices. C. Mallory-Weiss tear. D. 20. A 60-year-old patient with atrial fibrillation presents with severe abdominal pain out of proportion to examination. What is the most likely diagnosis? A. Appendicitis. B. Mesenteric ischemia. C. Ticulitis. D. Bowel obstruction. 21. A 10-year-old boy presents with a barking cough, inspiratory stridor, and low-grade fever. What is the most likely diagnosis? A. Croup. B. C. Asthma. D. Bronchiolitis. 22. A 45-year-old woman presents with unilateral eye pain, redness, and photophobia. On exam, intraocular pressure is elevated. What is the most likely diagnosis? A. B. Acute angle closure glaucoma. C. D. Corneal abrasion. 23. A 25-year-old woman presents with abdominal pain, shoulder tip pain, and vaginal bleeding. Pregnancy test is positive. What is the most likely diagnosis? A. Placental abruption. B. Miscarriage. C. Ectopic pregnancy. D. Molar pregnancy. 24. A 70-year-old man presents with fever, productive cough, and pleuritic chest pain. Chest X-ray shows lobar consolidation. What is the most likely diagnosis? A. Pneumonia. B. Pulmonary embolism. C. Exacerbation. D. 25. A 28-year-old man presents after a fall with a midshaft humeral fracture. What complication is most likely? A. Radial nerve injury. B. Ulnar nerve injury. C. Median nerve injury. D. Axillary nerve injury. 26. A 55-year-old diabetic presents with fever, hypotension, and severe pain out of proportion to examination at the left leg. What is the most likely diagnosis? A. Cellulitis. B. Necrotizing fasciitis. C. D. Mellitus. 27. A 20-year-old man presents after a high-speed car crash with distended neck veins, hypotension, and muffled heart sounds. What is the diagnosis? A. Tension pneumothorax. B. Cardiac tamponade. C. Massive hemothorax. D. Myocardial infarction. 28. A 60-year-old man presents with melena, hypotension, and tachycardia. What is the most likely source of bleeding? A. Lower GI tract. B. Small bowel. C. Upper GI tract. D. Rectum. 29. A 22-year-old man presents with headache, fever, and neck stiffness. What is the next best step in diagnosis? A. Brain. B. Lumbar puncture. C. CT brain first, then lumbar puncture. D. 30. A 50-year-old man presents with slurred speech, ataxia, and nystagmus after prolonged alcohol use. What is the most likely cause? A. Wernicke's encephalopathy. B. Korsakoff syndrome. C. Cerebellar stroke. Hypoglycemia.